you can see it on the screen?
Yeah.
Brilliant.
Clive Waring has one of the worst cases of
Oh, yeah.
amnesia.
Yeah,
in the world.
I use this video all the time in my training, teaching.
I assumed as much.
They did now. Day and night, same brain. No difference in dreams or anything like that. No senses at all. The brain has been totally inactive. No dreams, no thoughts of any kind whatever.
Clive was a renowned conductor living in London when he was struck down by a virus in 1985. Parts of his brain were completely destroyed, including his memory. However, his ability to play music is unaffected.
Do you feel different when you play music?
I've never heard a note since I've been ill. I don't know what it's like to play music. When you're unconscious.
You played us some music about 2 minutes ago.
Not known to me. Totally unknown. I've never heard a note yet.
Clive's case became known to millions when a television documentary was made about him in 1986. Alone and confused in hospital, without his memory, the only person he recognised was his wife, Deborah.
What's been wrong? Can you just tell me what the illness has been? I really can't get to this. I'm actually conscious now for the first time. I just want to find out what the bloody hell they've been doing and what's been wrong with me. Because I haven't a fucking clue.
Well,
I've never seen anyone at all.
20 years later, Clive only has a 7-second memory before his mind goes blank.
It gets to me every time. It genuinely, it pulls at my heartstrings in all the extreme ways. Can you explain a little bit about what's going on? I assumed that you knew this case.
Oh, yeah. We use this all the time in teaching. It's very powerful demonstration, especially, you can think about what it's like. It's hard to imagine what it's like for him and the pain, that of his wife, having to deal with this. And it's quite significant. So, he, I believe he had a limbic encephalitis, so bilateral medial temporal lobe damage that basically, damaged the hippocampus and made it impossible for him to lay down new memories. So they talked about he has a 7-second memory. So that's basically, your brain holds on to what we often call short-term memory, things that just happen or things that are just in consciousness. People don't remember phone numbers anymore, but we used to say you hold a phone number in mind. That's like short-term memory. So password, I guess, would be the equivalent now. That's all he's got. So he can only hold whatever's in consciousness at any given moment or a connected moments. And as soon as that's interrupted, it's the hippocampus that is involved in the transfer of that information to the cortex so that you can maintain this ongoing sense of consciousness. So what's so interesting about that, hearing him, is he says, it's almost as though he's using neuroscientific terms. He says, I'm not conscious. And he's like, what's going on? I'm not conscious, which is an incredibly sophisticated thing to say, to describe this experience and kind of captures, what we as experts would the kind of language we would use to say, like, consciousness is the ongoing record of experience over time. It's not all it is, but to think of the consciousness of the self as a continuous entity in time, it's, recording of experiences from one moment to the next, 1 hour, minutes, hours, days, weeks, and so on. And all he has are seconds, of that. And so that's the kind of consciousness that we study. And that's what we call anterograde amnesia, which is contrary to what we talked about at the beginning, which is retrograde amnesia, where you lose consciousness for your past or inability to access your past. But your ongoing experience of consciousness is supposedly normal in the sense that you are remembering and encoding and retaining information over time.
Right. The shortness of that time was quite surprising to me as well. So is 7 seconds the duration? I know it's roughly variable. I think they say sometimes it's 15 or sometimes it's 20, but it's kind of no longer than 30 seconds.
Well, it could be.
That's our short-term memory. That's our short-term storage.
If it's uninterrupted, it could be. So for example, HM, who's a similar syndrome, you could hold a conversation with him, and I never met him, but but I know this is the case, and maintain that information, and he would have an ongoing record of that, even if it were minutes longer, but as soon as there was an interruption, if you left the room and came back, it would be gone. The memory would be gone. So in his case, 7 seconds, I think he had more extensive cortical damage in the limbic encephalitis case. HM was more of a surgical resection, surgical resection in the background of epilepsy. But so he may have had more extensive kind of cortical damage that shortened his time window of experience. But I would, and I haven't watched that full documentary in a while, but I would be interested to know, if she sat with him, because you can see there are clips that I use in my teaching of that same, from that same documentary where he's having a conversation and he's keeping track. Like you're sitting with him and he's keeping track of the conversation, which suggests that it can go longer than 7 seconds. Well, that may have been something that they said, under certain circumstances in the documentary, but I think that
it's a catchier heading.
Yeah.
The effect is communicated.
Yeah.
So what is it that's happening at the point that you break your consciousness or switch focus from one thing to another?
So a better way to answer that might be what's happening in the norm when you do have, why do we have a continuous consciousness? So I imagine, we don't know what consciousness is like in other creatures, other, lower species. Like, we like to talk about our dog a lot, and the stuff that happens, and we're like, is he going to remember, if we leave and we come back, it's like, in fact, in that documentary, there are clips of him seeing his wife, and it's as though she's seeing him for the first time. He's seeing her for the first time, and it's like, as far as he's concerned, he doesn't even know when he saw her last, but he recognizes her, and he greets her with just tremendous, emotion, even when he just saw her. And that's kind of, not to, I don't want to draw a comparison between him and a dog, but that's what our dog does. When we go out and we come back after an hour or two, it's like, oh my God, I can't believe, So anyway, the question is, what is it that keeps, what is it that allows you to maintain that record of like, I am, even when you sleep, there's stuff happening, my colleague, the philosopher Evan Thompson, has a whole book about this called Waking, Dreaming, Sleeping, Dying, I think, where if you wake up, someone says, well, how did you sleep? You're going to, even if you weren't conscious, quote unquote, conscious the whole time, you have a record, you have information about that experience, right? So, and of course, when we're awake, it's an ongoing record of experience. So what is it that allows us to do that? And the way I think about it is that, there's a stream of incoming information about your life, things that you're experiencing, and short-term memory, the cortex of the brain, the sensory systems can support that information online. By online, I mean seconds. But then, if I turn and look at something else, there's going to be something else coming into my cortex or another sound that's going to occupy that, and I can't maintain. So then how does that information that was over there that I'm no longer attending to, there's still a record of it somewhere. And the way I think of it is that information resonates, it connects with other areas of the brain, perhaps the hippocampus is involved, and it's through that kind of like resonance, that's an echo that allows you to kind of like maintain that and carry over from one second to, from one episode to the next, or over those breaks, basically. And and you could see in that, and certainly when we talk about, what we say long-term memory, he doesn't have that. Clive doesn't have that.
Yeah. So just to be clear, the damage in Clive's case is to the hippocampus. And the reason that he can't form new memories is that that's the hippocampus's job, is to basically take short-term memories, consolidate them, and turn them into long-term memories.
Basically. And I haven't looked at his anatomy. It's been a while since I looked, but I think he also had more, as a limbic encephalitis case, he would have had more also damage to the cortex surrounding the hippocampus, which may have kind of further compromised his ability to kind of retain ongoing information even more so than HM. But, they're basically both very severe cases of amnesia. And the essence of what you're saying is that, correct, I would agree with, is that they, without a functioning hippocampus, you can't encode ongoing experience. That's basically what anterograde amnesia is.
Yeah. And what makes that clip even more compelling is that it brings up this difference between implicit and explicit memory that you bring up, that he is still a fantastic musician.
Yes.
And this is sort of, it illustrates that concept better than I think you could ever possibly explain it. You talk about how his musical abilities are completely untouched.
So, those abilities don't require conscious ongoing effort to execute whatever the sequences of notes. It's just basically a program that's run without, that's run so-called implicitly without. But even, this is perhaps more not as prosaic of an example, but think about the fact he can talk. So he is a gifted, professional musician, and it's dramatic to see, oh my God, he can do this incredibly complex thing. Speaking is just as complex. Having a conversation is no less complex, than what he's doing on the piano, and he can do that too, and that's what we can all relate to. So if any of us should have the terrible misfortune of, having this kind of damage, we would still be able to talk, right? And that's why aphasia, when that is damage, is so devastating for people, because, then you've lost that function is very devastating. So how is it that we can talk? How is it that we can do things? We can walk, we can move, that's memory, right? Because it's some form of memory. It's implicit memory for whether it's motor function or, sequences or understanding how things work, that I can you use utensils or do sophisticated things with tools. Those are all we would consider under this form of implicit memory, which is stored knowledge, which is very resistant to brain damage, and it's generally not affected by hippocampal damage. That's why patients, even with severe damage to parts of their brain, provided they don't affect the language systems or the motor systems in these cases, they can still talk, they can still move around, do stuff.
If you enjoyed that short podcast clip, then be sure to click on the full podcast that you can watch here.